Have you looked at your hands today? Not to admire them, not to check your nails, but to see what they might be trying to tell you about your health. Most people believe kidney disease starts with pain, but that's one of the biggest misconceptions. In reality, kidney disease is often called the silent disease because it can quietly damage your body for years before you notice anything is wrong. In fact, according to the National Kidney Foundation, many people lose a significant amount of kidney function before experiencing obvious symptoms. But here's what surprises many of my patients. Sometimes your hands begin showing subtle warning signs long before kidney disease is diagnosed. Dry skin, swollen fingers, changes in your nails, persistent itching. Even tiny changes that seem completely unrelated may actually be your body's way of asking for help. Today, I'm going to explain 9 warning signs that may appear in your hands and what they could mean. Some are harmless, others deserve prompt medical attention. Most importantly, I'll explain why they happen and what you can do to protect your kidneys before permanent damage occurs. And be sure to stay until the end, because the final warning sign is one that many people dismiss as simply getting older, when it may actually deserve a closer look. Hello, I'm Dr. Richard. Welcome back to the channel. If you're new here, every week we explore evidence-based health information designed specifically for adults over 60. Our goal is simple: to help you stay healthier, more active, and independent for as many years as possible. If that sounds helpful, consider subscribing and turning on notifications so you never miss a future video. Now, let's begin by understanding something incredibly important. A few years ago, a lovely woman named Margaret came into my clinic. She was 71 years old. She wasn't there because of kidney pain. In fact, she had no pain at all. She simply mentioned something almost as an afterthought. She said, "Doctor, my hands have been swelling lately. My rings don't fit anymore, and my skin feels dry no matter how much lotion I use." She assumed it was simply aging, maybe arthritis, maybe the weather. Those were reasonable possibilities. But because she'd also been feeling unusually tired, I decided to order some routine blood and urine tests. Those tests revealed something she never expected. Her kidneys were functioning well below normal. Fortunately, we discovered it early enough to begin treatment and make important lifestyle changes. Had she ignored those subtle signs for another year or two, the outcome could have been very different. That's why I wanted to make today's video. Because sometimes your hands quietly tell a story, long before your kidneys begin causing obvious symptoms. Why kidney disease is called the silent disease. Let's briefly talk about what your kidneys actually do. Most people think kidneys simply make urine, but that's only one small part of their job. Every single day, your kidneys filter roughly 180 liters of fluid from your bloodstream. They remove waste products, balance minerals like sodium and potassium, help regulate blood pressure, support healthy red blood cell production, maintain proper fluid balance, and even help activate vitamin D for strong bones. That's an incredible amount of work. The remarkable thing is, your kidneys have tremendous reserve capacity. You can lose a surprising amount of kidney function before obvious symptoms appear. That's helpful for survival, but it also makes kidney disease difficult to recognize in its early stages. By the time swelling becomes severe, or nausea develops, or appetite disappears, significant damage may already have occurred. That's why paying attention to subtle changes becomes so important. Why the hands can reveal kidney problems. Now you might be wondering, "Doctor, why would kidney disease show up in my hands?" That's an excellent question. Think of your bloodstream as a river. Healthy kidneys constantly clean that river. When the kidneys begin struggling, waste products, extra fluid, and mineral imbalances gradually build up. Those changes don't stay inside the kidneys. They affect your skin, your nerves, your muscles, your circulation, even your fingernails. Because your hands contain tiny blood vessels, many nerves, thin skin, and delicate tissues, they often reflect changes happening throughout your body. That's why physicians frequently examine a patient's hands during a physical examination. They're looking for clues. Not because every hand problem means kidney disease, but because the hands sometimes reveal patterns that deserve further investigation. When should you be concerned? Before we go through these warning signs, I want to emphasize something very important. Seeing one of these signs does not automatically mean you have kidney disease. Dry skin can have dozens of causes. Swollen fingers can result from arthritis, hot weather, certain medications, or simply eating too much salt. The goal of today's video isn't to create unnecessary worry. It's to help you recognize changes that shouldn't be ignored, especially if they occur together or persist over time. If you have diabetes, high blood pressure, heart disease, or a family history of kidney disease, paying attention becomes even more important. Those conditions significantly increase your risk of chronic kidney disease. Warning sign number 9. Persistent dry, rough hands. Let's begin with one of the most common signs: dry, rough, itchy skin on the hands. Most people assume dry skin is caused by cold weather or frequent hand washing, and often that's exactly the reason. But when kidney function declines, waste products can gradually build up in the bloodstream. At the same time, your body's fluid balance and mineral levels may become disrupted. Together, these changes can leave the skin feeling unusually dry. Some people describe it as feeling like lotion simply doesn't work anymore. The dryness returns almost immediately. Others notice tiny cracks around the fingertips, or skin that feels rough despite good skincare. This alone doesn't prove kidney disease, but if dry hands are accompanied by fatigue, ankle swelling, changes in urination, or high blood pressure, it's worth discussing with your healthcare provider. Because your skin sometimes reflects what's happening inside your body. Dry skin may be one of the earliest clues. But the next warning sign is even more common, and it's something many people blame on rings that have shrunk. In reality, the problem may not be the ring at all. Let's talk about swollen fingers. Warning sign number 8. Swollen fingers that won't go away. Have you ever tried to remove your wedding ring, only to discover it suddenly feels too tight? Or perhaps you've noticed your fingers look puffier than they used to, especially first thing in the morning. Many people immediately blame the weather, hot temperatures, arthritis, or simply getting older, and sometimes they're absolutely right. But persistent swelling in the fingers can also be related to fluid retention. Healthy kidneys carefully regulate how much sodium and water stay inside your body. When kidney function begins to decline, extra fluid may not be removed as efficiently. That fluid doesn't just collect around your ankles, it can also accumulate in your hands and fingers. Some people notice they can no longer wear rings comfortably. Others wake up with hands that feel stiff and swollen before gradually improving throughout the day. If swelling comes and goes after a salty meal, that's usually not concerning. But if it becomes persistent or is accompanied by swelling in your feet, around your eyes, or increasing shortness of breath, it's important to see your healthcare provider. One of my patients, I'll call him John, was convinced he'd simply gained weight. He laughed and said, "Doctor, I think my wedding ring shrank." Of course, rings don't shrink. His blood tests later showed reduced kidney function along with poorly controlled high blood pressure. After treatment and better blood pressure management, the swelling gradually improved. Sometimes, small changes tell a much bigger story. Warning sign number 7. Constant itching without a rash. Now let's talk about something many people never associate with kidney health: persistent itching. Imagine scratching your hands over and over again, yet never seeing a mosquito bite, a rash, or any obvious skin problem. This type of itching can become incredibly frustrating. Some people describe it as feeling like the itch comes from underneath the skin, rather than on the surface. Why does this happen? When kidneys aren't filtering waste efficiently, certain substances can gradually accumulate in the bloodstream. Researchers believe these changes, along with dry skin and inflammation, may contribute to itching in people with advanced kidney disease. Again, itchy hands don't automatically mean kidney disease. Allergies, eczema, new soaps, and dry winter air are much more common causes. But if the itching continues for weeks, especially if it's accompanied by fatigue, swelling, or changes in urination, it deserves medical attention. Simple tip. While you're waiting to be evaluated, using a fragrance-free moisturizer after washing your hands may help reduce dryness. Avoid very hot water when washing your hands. Hot water strips away natural oils and can make itching worse. Warning sign number 6. Frequent hand cramps or muscle spasms. Have you ever been holding a coffee cup, opening a jar, or writing with a pen when suddenly your hand cramps? The fingers tighten, the muscles lock, and it takes several seconds before everything relaxes again. Occasional cramps happen to everyone, especially after overusing the muscles. But frequent, unexplained muscle cramps deserve attention. Your kidneys constantly balance important minerals including potassium, calcium, magnesium, and sodium. These minerals act like tiny electrical switches. They allow nerves to send signals and muscles to contract normally. When those levels become abnormal, muscles may begin cramping unexpectedly. People with kidney disease don't always develop cramps, but when they do, they're often related to these electrolyte changes. It's one reason physicians frequently check electrolyte levels when evaluating kidney function. Many people immediately reach for potassium supplements when they experience muscle cramps. Please don't do that without medical advice. If someone already has kidney disease, taking extra potassium can actually become dangerous because damaged kidneys may struggle to remove excess potassium from the bloodstream. That's why it's always better to discover the underlying cause rather than simply treating the symptom yourself. Why these signs often appear together? By now, you've probably noticed something. None of these warning signs is specific to kidney disease. Dry skin, swelling, itching, muscle cramps. Each one can have many different causes. Doctors rarely diagnose kidney disease from a single symptom. Instead, we look for patterns. For example, if someone has diabetes, high blood pressure, persistent swelling, itchy skin, and abnormal blood test results, the picture becomes much clearer. Think of these warning signs like pieces of a puzzle. One piece alone doesn't tell the whole story, but when several pieces begin fitting together, it's time to take a closer look. So far, we've talked about changes you can actually feel: dryness, swelling, itching, cramps. But the next warning signs are often something you can actually see. Sometimes, your fingernails begin changing before you ever suspect a kidney problem. And those changes are important enough that many doctors routinely examine a patient's nails during a physical examination. Let's take a closer look at those signs next. Warning sign number 5: changes in your fingernails. Take a close look at your fingernails. Have they changed over the past year? Perhaps they've become unusually pale, developed horizontal white bands, or seem more brittle than before. Most nail changes are harmless and occur as we age, but occasionally they can provide clues about underlying medical conditions, including kidney disease. One change doctors sometimes look for is nails that appear unusually pale because of anemia. Healthy kidneys produce a hormone called erythropoietin, which signals your bone marrow to make red blood cells. When kidney function declines significantly, the body may produce less of this hormone. Over time, that can contribute to anemia, making the nail beds and skin appear paler than usual. Another change that has been described in people with advanced chronic kidney disease is the appearance of white bands or unusual discoloration across the nails. These changes are not common, and they are certainly not specific to kidney disease, but when they occur alongside other symptoms, they may prompt further evaluation. If you've noticed significant nail changes that don't improve over time, it's worth mentioning them during your next medical checkup. Remember, your nails are constantly growing, and they often reflect what's happening inside your body. Patient story. One of my patients, Susan, came in because she was concerned about her nails becoming unusually pale. She had assumed she simply needed more vitamins. But when we performed routine blood tests, we discovered she was anemic, and further testing showed reduced kidney function. Fortunately, because it was caught relatively early, we were able to identify the cause and begin appropriate treatment. Sometimes, what seems like a cosmetic concern turns out to be an important medical clue. Warning sign number 4: numbness or tingling in the fingers. Have you ever felt a pins and needles sensation in your fingertips? Or noticed that your fingers occasionally feel numb without any obvious reason? Many people assume this must be carpal tunnel syndrome, and often they're correct. However, persistent numbness or tingling can also result from nerve damage. In people with advanced kidney disease, waste products that are normally removed from the bloodstream may build up over time. These changes can affect the nervous system, leading to a condition known as peripheral neuropathy. Symptoms may include tingling, burning sensations, reduced sensation, numb fingertips, difficulty feeling small objects. Again, these symptoms have many possible causes. Diabetes is actually one of the most common. Vitamin B12 deficiency can also produce similar symptoms. That's why proper testing is so important. The key message is this: if numbness is persistent, getting worse, or affecting your daily activities, don't ignore it. Early evaluation gives your healthcare provider the best opportunity to identify the underlying cause. Warning sign number 3: trembling or shaking hands. Let's move to a symptom that often worries people: hand tremors. Perhaps you've noticed your coffee cup shaking, your handwriting becoming less steady, or your hands trembling while holding your phone. Many conditions can cause tremors: stress, certain medications, too much caffeine, thyroid disorders, essential tremor, even Parkinson's disease. Kidney disease is not one of the most common causes. However, when kidney function becomes severely impaired, significant electrolyte imbalances and toxin accumulation can sometimes interfere with normal nerve and muscle function. In advanced cases, this may contribute to tremors or involuntary muscle movements. This is generally not an early sign, but it's important to understand because it reflects how interconnected the body truly is. Your kidneys don't work in isolation. They help maintain the delicate balance that allows every nerve and every muscle to function properly. Why early detection matters. Here's something many people don't realize. Your kidneys are remarkably resilient. They can often continue functioning despite years of gradual damage, but that also means the disease can progress quietly. The encouraging news is that early detection gives you the greatest opportunity to slow progression. Managing blood pressure, controlling diabetes, avoiding smoking, maintaining a healthy weight, following your healthcare provider's recommendations. These steps can make a meaningful difference for many people with chronic kidney disease. That's why today's video isn't meant to frighten you. It's meant to encourage awareness. Awareness leads to testing. Testing leads to diagnosis. And diagnosis creates the opportunity for timely treatment. We've now covered changes involving your skin, your muscles, your nerves, and your nails. But the final 2 warning signs are perhaps the most noticeable. One often appears first thing in the morning. The other can be one of the earliest clues that your body is retaining more fluid than it should, and they may be easier to recognize than you think. Let's look at those final, and perhaps most important, warning signs next. Doctor warns: your hands reveal kidney disease. First, 9 warning signs after 60, part 4. Final part, approximately 6 minutes. Warning sign number 2: puffy hands when you wake up. Have you ever woken up in the morning, looked at your hands, and noticed they seemed unusually puffy? Maybe your fingers felt stiff, your rings were difficult to put on, or your hands looked swollen for the first hour after getting out of bed. Many people assume this is simply part of aging. Sometimes it is. Sleeping position, hot weather, or eating a particularly salty dinner the night before can all cause temporary swelling. But if this happens frequently, Especially alongside swelling in your ankles, feet, or around your eyes, it may indicate that your body is retaining excess fluid. Healthy kidneys work around the clock to maintain the right balance of water and sodium. When kidney function declines, excess fluid may gradually build up in the body. Because gravity affects where fluid collects, many people notice swelling in different places at different times of the day. Some wake up with puffy hands or eyelids. Later in the day, swelling may shift toward the ankles and feet. Again, this symptom alone does not diagnose kidney disease. Heart conditions, liver disease, certain medications, and thyroid disorders can also cause fluid retention. But persistent swelling should never be ignored. A simple home check. If your rings suddenly become tight without any obvious reason, or if your hands consistently appear swollen for several days, make a note of it. Also pay attention to other symptoms. Have you noticed higher blood pressure, increased fatigue, foamy urine, swollen ankles, changes in how often you urinate? When several of these changes occur together, it's time to schedule an appointment with your healthcare provider. Warning sign number 1. Your hands tire easily or feel unusually weak. Now we've reached the most important warning sign. It's one that many people dismiss as simply getting older. Weakness. Perhaps you've noticed opening a jar has become more difficult. Holding grocery bags feels exhausting. Using garden tools tires your hands much faster than before. Or your grip strength simply isn't what it used to be. Of course, aging naturally reduces muscle strength. That's completely normal. But kidney disease can sometimes contribute to weakness in several ways. If kidney function declines significantly, anemia may reduce oxygen delivery to your muscles. Electrolyte imbalances may interfere with normal muscle contraction. Poor nutrition can accelerate muscle loss. Inflammation may further reduce physical strength. Together, these changes can leave you feeling weaker than expected. Research has consistently shown that reduced grip strength is associated with poorer overall health in older adults. While it is not a specific test for kidney disease, it can be one piece of the bigger picture that healthcare professionals consider. If you've experienced a noticeable decline in strength over a relatively short period, don't simply assume it's because you're getting older. It's worth discussing with your doctor. How to protect your kidneys after 60. Now for the good news. Many of the biggest risk factors for kidney disease can be managed. Here are several habits that support kidney health. 1. Keep your blood pressure under control. High blood pressure is one of the leading causes of chronic kidney disease. Checking it regularly and following your treatment plan can help protect your kidneys over time. 2. Manage blood sugar if you have diabetes. Diabetes is another major cause of kidney damage. Keeping blood sugar within your target range can significantly reduce the risk of complications. 3. Stay well hydrated. Most people don't need excessive amounts of water. Instead, aim for consistent hydration throughout the day, unless your healthcare provider has advised you to restrict fluids. 4. Eat a balanced diet. Focus on vegetables, fruits appropriate for your health needs, whole grains, beans and legumes, fish, healthy fats like olive oil. Try to reduce excess sodium and highly processed foods, which can contribute to high blood pressure and fluid retention. If you already have kidney disease, your dietary needs may be different, so always follow the advice of your doctor or a registered dietitian. 5. Stay active. Regular physical activity helps improve circulation, supports heart health, maintains muscle strength, and helps control blood pressure and blood sugar. Even a 30-minute walk most days of the week can provide meaningful health benefits. 6. Don't ignore routine blood tests. One of the easiest ways to detect kidney disease early is through simple blood and urine tests. Ask your healthcare provider about checking eGFR, estimated glomerular filtration rate, serum creatinine, urine albumin or protein. These tests can often identify kidney problems long before symptoms become obvious. I'd like to finish by returning to Margaret, The patient I mentioned at the beginning of today's video. She didn't come to my clinic because she thought she had kidney disease. She came because her hands felt different. She noticed swelling, dry skin, fatigue. None of those symptoms alone pointed directly to her kidneys, but together they told a story. Because she listened to her body and sought medical advice, her kidney disease was identified before it reached a more advanced stage. That gave her the opportunity to make meaningful lifestyle changes, manage her blood pressure more effectively, and receive appropriate treatment. Today, she is still gardening, playing with her grandchildren, and living an active life. That's exactly why awareness matters. Not because every symptom means something serious, but because paying attention gives you the best chance to catch problems early when there's often the most opportunity to help protect your health. If today's video helped you better understand the subtle ways your body can communicate with you, please give it a thumbs up. It helps YouTube share this information with more people who may benefit from it. And if you haven't already, subscribe to the channel and turn on notifications. Every week, we share practical, evidence-based health information designed to help adults over 60 stay healthier, stronger, and more independent. Finally, I'd love to hear from you. Have you ever noticed changes in your hands that made you wonder about your health? Share your experience in the comments below. Your story may encourage someone else to seek medical advice sooner. Thank you for watching. I'm Dr. Richard, and I'll see you in the next video. This video is for educational purposes only and should not be considered medical advice. The signs discussed can have many different causes, and none of them alone can diagnose kidney disease. If you experience persistent symptoms or have concerns about your health, consult your healthcare provider promptly for a proper evaluation and appropriate testing.